one alum from 2007, another alum from 2011, one 2012, of course, 2012 here, and maybe some of you that are giving your presentations will come back and gloat and feel relieved that you don't have to give another presentation here again. But those that have taken this course have gone on to great things. You already heard from Megan Banner after 18 countries after graduating from this program. So we're very happy to have Bill Law here. Bill is going to be our first presenter on 2014 TED.
Good. I woke up one morning last summer, threw my clothes on, hopped in my car, got on my way to work. Before crossing Route 1, as I was pulling onto the highway, I saw a bike rider on the side of the road, his bike strewn across the highway. I had a decision to make. Do I call 911 and keep driving and hope the ambulance gets there in time? Or do I get out of my car and provide my first responder training to this man while still calling the ambulance? I got out of my car and helped the man and got the ambulance underway. The ambulance arrived within 10 minutes and got the man to the hospital where he received care for a broken collarbone and cracked ribs. It could have been a lot worse. The situation could have been a lot different if I was here in Port-au-Prince, Haiti, in one of the shanty towns that many people live in. If I was to call the ambulance in this town, it might never arrive. It could come after the time was too late. My name's Bill Law. I'm a student at the University of Rhode Island, as well as an emergency medical technician. And I'm going to be talking today about creating an international standard for first responder emergency medicine. I'm going to begin talking about the healthcare situation that we have right now in the world, and I'm going to then talk about a few examples of emergency medicine in the developing world, and finally talk about my plan. So, health in a nutshell. What's the method that we need to use to get healthcare to the people that need it? First of all, as many of the presentations will discuss, we need prevention. Prevention is the best way to save money. And without prevention, we're going to have diseases and accidents running rampant around the world. Diseases and accidents will slip through the cracks, and we need treatment. We need people that are there to treat these diseases and to treat the people that suffer from these accidents. And finally, we need sustainability. We need to have prevention methods, and we need to have treatment methods that are low cost, efficient, and rapid to get prevention and treatment to the people that need it the most. In 2011, the leading cause of death, as you can see here in the world, was ischemic heart disease or coronary artery disease. In total, 55 million people died in the world in 2011. To put that in perspective, that's 55 times the amount of people that live in the state of Rhode Island dying in 1 year alone. What does all this disease and dying affect? How does all of this disease and dying affect the world? Well, not only are there economic losses from all the people that suffer from diseases and death, but their families also suffer from morale deficits as well as supportive measures that they may not have later on in life. Emergency medicine can address these problems. In 2001, the World Health Organization published this study on emergency medicine and said that 21.7 million deaths in the year 2001 alone could have been aided through emergency medical services. That's approximately 45% of the deaths in that 1 year alone. How are they addressing this? Here's a picture of a community health worker in a rural location in Africa. He's going to this house to provide preventative education methods as well as some treatments to this house. There's many different kinds of community workers around the world. Some have extensive training while others have minimal training, and different community health workers focus on different aspects of community health care, including multifaceted approaches and single-faceted approaches. An example of a single-facet approach would be a traditional birthing assistant who's only trained in obstetric prevention and obstetric medicine. They may not have the emergency first responder training that all community health providers should be expected to have as members of their communities. Community health providers do face a lot of problems. Communication is probably the biggest problem because to get your community health provider to you, you have to contact them. If you don't have cell phone service or a way to contact them, no help for your emergency will arrive. And then you also have world travel times. The darkest regions of this world are the ones that are furthest out of reach from the nearest city, with over 10% of the population being outside of 2 days of a transport time to the nearest location. So what are people doing about emergency medicine that comes up in the developing world? One study of the Nijakabale Hospital in Uganda was of an emergency cadre. They basically trained emergency healthcare practitioners and then emergency healthcare technicians that go out on the ambulance and bring patients back to this hospital. The hospital was actually built in 2008, so it's fairly new. And within the first 500 patients, 1/3 of the people that they treated were released directly after treatment to go back to their village and sustain their families. That shows you just how efficient their program in emergency medicine connected in the community was. A second project was in the Bermejo municipality in Bolivia, specifically the town of Colonia Linares. This program was more focused. It's more on obstetric emergency care. They trained over 600 effective rapid response emergency obstetric professionals who had two-way communications by radio with people in the community and prevented massive amounts of maternal health and deaths. It's kind of blurry, I know, but this is a picture of my friend Laramie. We were actually in a program together in Ecuador this past summer, and beside her is some of the buses that we would travel on normally during our days in Ecuador. Specifically, this bus rolled over, causing 35 injuries and 7 deaths just in this one accident. Laramie sustained 4 to 5 broken ribs, a crushed T7 vertebrae, as well as 2 collapsed lungs. Luckily, the healthcare system in Ecuador is sufficient enough to provide her with emergency care and get her to the closest hospital, but in other places, it's not as sufficient. In Ghana, they're addressing this problem through a program that's trained over 300 drivers of commercial vehicles, whether buses, taxis, or commercial trucks, to get health care and initial response to the people that need it the most. So what's my plan? My plan is to create an international training program for first responders. This is not just nation to nation, but internationally, the most basic level to get people the care that they need. The focus of the program is first, identifying when a true emergency is taking place. Second, getting these people to understand what they need to do to sustain this person's life. And last, to get this person to the nearest healthcare facility. The methods of the training need to be appropriate to reach all languages of people as well as illiterate. One example of a method to use to achieve this is from the India Institute of Technology. They actually published an emergency first responder book that uses pictures and scenario-based learning to show people how to administer emergency treatments. The initial population of people that I wish that this international standard should be distributed to are community health workers, as I discussed earlier. There's already mechanisms in place for training these people, and they have trainers in place that are qualified enough to teach this first responder training. And by teaching community health workers, it will spread around the globe. The costs are minimal if you start with this initial step, and the only costs involved are with regard to training and incentivizing the program. Funding may come from national EMT organizations such as NREMT in the United States and World Health Organization and World Banks. My wish is that all people, no matter their income, geographical location, living conditions, or any other determinant, will have access to immediate emergency care necessary to save their lives as well as the lives that they touch. I'd just like to finish up with one last story from Chone, Ecuador, where I was last summer. This was the rural portion of my program in Chone, and I had the opportunity to be in the pediatric floor of a hospital where I met a young man named Mateo and his mother who had traveled over a day on the back of their donkey to reach the hospital. There's no ambulance that could have taken them and no car. And luckily, thanks to the hospital, Mateo received the treatment that he needed to survive. With my program for an international standard of emergency medicine first responders, this problem may not arise because people like Matteo will understand that they need to get to the hospital immediately in a true emergent situation, as well as understand the techniques to sustain their lives. There's Matteo. Thank you. Okay. Go ahead. I've been in EMT for over 2 years. Sorry. What?
What is it that got you to Ecuador and a lot of EMTs just stay in this area? How did you get going out?
Okay, so I didn't go to Ecuador as an EMT. Well, I went to Ecuador and I am an EMT, but it wasn't connected really. The program that I did in Ecuador was an urban rural comparative health program through an NGO that lets students observe in hospitals and stay with families to better understand healthcare in different countries. And while I was there, obviously I was exposed to different emergency situations as a result of being in a developing or a lower income country, but not related exactly. No problem.
I have a question. Is your proposal something that could utilize as well as inner city American nations that are developing?
So actually,
states rather.
Yeah. So actually, the way I looked at it initially, I came up with the idea because in the United States right now, there's a large movement towards bringing paramedics into the communities to do primary care, which is called community paramedicine, because we don't have enough primary care physicians. So I was thinking about it, and they're getting more primary care type positions in developing countries, such as the community health workers. They don't have enough, but they're getting more. And a lot of times they're forgetting about these emergencies that are taking place. So if we reverse engineer the system, we can get those people that are involved in prevention and primary care to be trained in the basic first responder medicine. So it's definitely applicable in the United States because they are doing community paramedicine in different rural areas as well as urban areas.
So it's win-win for us and for developing countries.
Yep.
Thank you, Ben.
Thanks. Get me out of this thing.
All right, everyone, let's welcome Nicole to TED.
Hello everyone, I'm Nicole Turgeon. I'm a student here at URI. Today I'll be discussing the fight against malaria with you, but I'm not going to be letting mosquitoes around so you can get bitten. So I'd like to just take a minute and put you all in a scenario. As summer's approaching, let's picture we're around a campfire, it's warm out, and all of a sudden one of us, we get bit by a mosquito. What's the first thing we're going to do? Most likely pick up a can of bug spray and spray yourself to protect you so that way you won't get bitten again. But you're probably not thinking you're going to die from this mosquito bite. And you're also probably not thinking about the child that dies every minute from malaria that was caused by a mosquito bite. Malaria is a curable disease. What if that can of bug spray could save that life? When malaria has claimed a life, everything stops. As I said, it is preventable and it is curable. It's a mosquito-borne disease. It's caused by a plasmodium, which is a parasite. The most common is Plasmodium falciparum, and that is most common in Africa. Many cases go undiagnosed because there's not proper treatment. And in Africa, of the over 1 million deaths that occur each year, 90% of those are children under 5 and pregnant women. As you can see in this map, all the red is malaria endemic areas. Malaria has a 95% mortality rate, but if it is diagnosed in a timely manner and is treated accurately, it can be cured. I'd like to talk about rapid diagnostic testing, which are test cards that look like this, and in this picture you can see they're collecting a blood sample. The blood sample goes in this area, and within 15 minutes will tell you if you are positive or negative. You see there's 2 lines here for positive, 1 for negative. And again, this happens in 15 minutes. And it will also tell you what type of malaria you have because there are multiple types of plasmodium. The way this is treated, if a child is positive is they get artemisinin combination therapy, which you see here. They have pictures to show when to take it, day or night, because if it's a child or if it's an illiterate mother giving them the treatment, then they will be able to accurately dose the treatment. This is first-line therapy for Plasmodium falciparum, and the World Health Organization has established this worldwide. The artemisinin kills the majority of the parasite first, and then the other combination drugs slowly kill the remaining of the parasite. So I would like to just think for a second. So malaria is caused by a mosquito, transmitted by a mosquito bite. 60% of residents in the Northeast say an itchy bug bite is what they fear most about a mosquito. Do we think that the 627,000 African children that died from this fear an itchy bite from the mosquito, or death that could occur without being treated? So this is bringing me to what I want to do. I want to fight malaria. I want to end it. With my wish, we could help rid these children the fear of a mosquito bite. My wish is to develop a strategic, sustained partnership between OFF, owned by SC Johnson, and the Power of One campaign, which was created by the Malaria No More organization. Doing so, OFF will provide $1 of every insect repellent spray to the Power of One, where they will provide a child with a rapid diagnostic test, RDT, and an artemisinin combination therapy, ACT, to a Zambian child. And as you can see here, OFF is the main company that would be providing the dollar, which the $1 goes to the test and essentially saves the child's life. So I'll talk to you now about what the Power of One campaign is. As I said, they were created by Malaria No More in the fall of 2013. So it hasn't even been a year yet that they've been established, and already they've treated and provided 2 million RDTs and ACTs to children in Zambia, which is where they're based in right now. And again, the cost is $1. This provides them $1 saves the life. So how are they sustainable and effective? They work with the African governments and also John Snow International, and this is how they distribute the treatments and the tests, and they're able to track them to ensure that they're going to the children, because the African government and John Snow International plug into a data system where the treatments are, at what time, and when they arrive to Zambia, and when they arrive to the villages and clinics that they're treating. I would like to discuss now prevention of malaria and how the bed nets that are being used are somewhat not effective anymore, because oftentimes they're either misused, they're resold, and even though they're long lasting, they rip. So even if you have a mosquito net that's covering you and is insecticide treated, the treatment can wear off, it might not get retreated, the mosquitoes can get through these massive holes that are there. People in Africa, they might not know the correct usage of it. Even if they're taught, they might want to sell it for more money to provide food for them. So that's why treatment, diagnosing them and providing treatment is so essential right now. Next, I will talk about SC Johnson, a family company, and OFF. SC Johnson makes $9 billion per year. $9 billion. They value family, sustainability, and creating better communities. So partnering with the Power of One will help them promote all of these values. The partnership is not just a one-way street. SC Johnson is not just going to provide them with the money. They're not just going to donate the money. This is going to be a symbiotic relationship. There's going to go both ways. So SC Johnson will provide them the $1 from OFF insect repellent, and in return, the Power of One will produce on-product labeling, and also a page on the OFF website, SC Johnson website, and their own Power of One page, which will explain the partnership, the relationship, what they're fighting, why they're fighting it, and how it's working. And we'll be able to track the progress to ensure that it is sustainable and that it is effective. So as I said, it's a partnership that is going to work both ways. SC Johnson works in over 110 countries, and the Power of One will also be able to promote this to the untapped people in these countries that don't know about them. Finally, creating this will help Power of One exceed their goal of providing 3 million treatments in 1 year. As I said, they're already at 2 million. So if this were to happen, it would be astronomical. There would be so many more lives saved, like this young girl. You can see she's happy. Like, we should want to make these children happy and make them have a good life, that one that they actually can look forward to and not being feared just by one single mosquito bite. So again, this will also allow Malaria No More to target subsequent countries to put more Power of One campaigns in, because as of right now, it's only in Zambia. So it will make significant progress in the fight against malaria. It will also allow us to begin crossing over the $3.6 billion fund gap that is here for malaria control in Africa and work on the eradication of it. Also, tomorrow is World Malaria Day, so if you want, go out and donate, do something to help fight the cause. Thank you.
How is Power of One funded right now?
Well, Malaria No More is like providing them with the funding, and Malaria No More is partnered with many other companies, many other organizations like Bill and Melinda Gates Foundation, and also mostly donations.
Do you know any information about the sales of off annually? Like could you project how many lives would be saved as a direct result of this?
I can't, because I tried contacting off and they weren't able to give me the information I needed. But if we look at the $9 billion that SC Johnson makes and then figure they have multiple companies that they own, kind of dividing it up, it would probably be close to $1 billion that they make, and then the off products were somewhere around that.
They make a lot of products. Are you going to target certain products for certain countries? For example, there are aerosols, there are applications, creams, there are, I don't even know if they do a repellent. That is outside of DEET, it's all DEET based, isn't it?
Yes.
And so the formulation will be based on different countries. Is that the whole idea?
Well, as of right now, they're only working in Zambia. So eventually, that would be the goal, is to get Power of One into more countries, so that way they could provide more treatments. And yes, with off in here, they would hopefully start with just like the bug actual sprays, because that's essentially one of the more popular one of the more popular things that people buy, especially in the summertime, is like in America.
Yeah.
But they work all over the world. It's not just in America. But we all know bug spray is extremely common in the summertime, and even in warm places, not in the summertime. But just the sprays mostly. And as I said, on product labeling, so that way people see that off is working with the Power of One, and if they're seeing that one of their dollars is going to be saving a life, they're more apt to buy this product.
All right, everyone, welcome to Renee. Welcome to Ted.
Over the past semester, I was able to pick a country to follow its current events. I was able to form a character of a citizen residing in this country. And with this opportunity, I became passionate about the ongoing problems in my country. I chose to select the Middle Eastern country of Syria. As many of you already know, Syria is in the middle of a 3-year civil war. After After constantly reading about Syria's current events, my mind was drawn to one part of the population in particular, the children. My name is Renee Perlman, and I am an activist for the health of children. Now, one might think she's not a doctor, so what could she possibly do to help the health of a child? Well, the answer is simple. I want to provide mothers the education and information on vaccinating their child. Why? Because there is an estimated 200,000 pregnant Syrian women in need of urgent prenatal care. An estimated 500,000 Syrian children that go unvaccinated, and a large portion of the population that is infected by infectious diseases are under the age of 2. Why is this relevant? Well, because there are so many children that are not vaccinated. However, there are infants on the way that are at high risk for potentially deadly infectious diseases. If that's not convincing enough for you, well, currently, Syria is in the middle of a polio outbreak, which is mainly targeting children between the ages of 0 and 5. Now, families are trying to scramble, look for vaccinations, and unfortunately, there's a shortage because there aren't many hospitals in Syria at the moment. So in the developing nation, we have learned that it's all about being proactive in order to stop diseases. My vision is to equip all Syrian mothers with the tools to know how to vaccinate your children, where to vaccinate your children, and the appropriate and specific ages to vaccinate your child. Providing mothers with the vaccination education can eliminate outbreaks like the polio virus. Unvaccinated children, or vaccinating children, can help eradicate diseases like measles, mumps, meningitis, and polio. Now, some reasons why children in Syria go unvaccinated are because the large family size. This average family size is about 6 people. And the culture also believes in third generational living, so you live with your grandmother, your mother, your father, and then there are the children. So unfortunately, the mom's duty is distracted, and she can't take care of her child's health to the full extent. And the main reason is due to the civil war in Syria, families are being displaced to refugee camps in neighboring countries, and pregnant Syrian women are giving birth to their child in germ-infected camps, along with many unvaccinated children who are currently residing there. Being born in the war-torn country of Syria, mothers easily lose track of the exact birth date and age of their child. This makes it very hard to know exactly when you need to vaccinate your child. So I'm going to share some troubling statistics about vaccinations in the Syrian population. So about 68% of the Syrian population is vaccinated with pertussis and tetanus vaccination, the DPT1, which sounds like a lot, but it's not, because the other percentage of the world, of the population, if you get it, it spreads very easily. As we know, pertussis is very contagious, and tetanus, they're in a war zone, so there are things flying everywhere. It's very easy to get it. And it counteracts it because it's a 2-dose shot, so only 45% of the country has a second dose. So if you're not fully covered if you don't have both doses. You're still very high chance of getting both pertussis and tetanus. Also, 52% of the country has the polio vaccination. As you know, as I've stated, they're in an outbreak right now, and it's because half the population isn't covered by the vaccination. About 61% of the country is covered with meningitis and pneumonia vaccinations. And the most troubling one for me is that only 43% of the country is covered with Hep B vaccination, which is the first vaccination you get when you're born. You get it when you're an infant to 2 months. And also, the influenza shot is only at 45%, which is, everyone knows influenza is an epidemic everywhere in the country. It's easily spread, and infants and elderly are at high risk for it. So, my TED wish is to provide the Life Kit to all Syrian refugee camps. The Life Kit would be handed out to pregnant women or new parents to help guide them in vaccination protocols for their child. So, what is the Life Kit? It's a weatherproof, durable box, and it's small and compact, so it's easy to store. And in it, there is a calendar. So if your child is born April 24th, 2014. You're going to have a calendar for 18 years, so it will go from right now to April 24th, 2032, and you'll be able to like track where your child is at, so you can like cross off the days, and so you know like when they should get the vaccinations. And along with that, so you know what vaccinations they should get, I have a vaccination protocol sheet, and it's the guide to help give your child a better life. And in it has when your child should be vaccinated. So at birth and between birth and 2 months, there's the Hep B vaccination, and then it says 2 months, you're supposed to get the RV vaccination. It has a whole list. So the mom can go through and check off when their child gets vaccinated. And now many of you might think, why would someone just go look in a box to get pieces of paper to cross out things? Also, it comes with an electronic pre-programmed beeper. So when the mother has a child, they program it. It gives the exact date of the age, and it will go off. It will be, so at 1 month when they think, you're supposed to get your Hep B shot, it will go off so that like you go look in the box, that you're not gonna just go, oh, one day I'm gonna go look, and it's gonna be already there for you. It's gonna alert you. And it also comes in different languages, so like the origin is Arabic, so I had it done in Arabic. And I think this is really effective because when you are in a war-torn country like Syria and you're in a refugee camp and you're displaced, you're thinking, is my child safe? Not, is my child vaccinated? So if we provide them, or if I provide them with these boxes, they're not gonna have to worry about that. It's gonna be already there for them. And this is also good because infectious diseases spread very fast in these camps, so parents die at a very young age and the child has to become an adult at 10 years old. So this will help them keep record of where they're at in their immunizations. And in future plans, I know I'm focusing right now just in Syria, but I know it's just a huge problem, but I want to take it to other refugee camps where they're having similar problems. And I know that this will be successful because, as we already all know, education is key. So I'm giving Syrian parents all the equipment so that they have the information to help their child live a healthier, longer life. And something as little and inexpensive as an 11x7 box can give the child an opportunity to live a long, prosperous life. So if my wish comes true, millions of children can be protected from preventable infectious diseases, such as ones that are already eradicated in the United States and just as well can be eradicated in Syria and other refugee camps around the world.
What are you going to do to combat the problem of illiteracy in some of these camps? What if people don't have to go to your week?
Well, in the refugee camps, they're run by like the WHO and UNICEF, so there'll be people there to guide them and help them. I don't.
So the refugee camps are run by WHO, or whoever they're run by?
Right.
Are these organizations equipped to provide the vaccine, so if the parent knows they need to go get the vaccine for their child, is it something where the availability would be there?
Well, actually, on my kit thing, it's like location specific, so I missed that. I'm sorry, but so like say, because there's Syrian camps all around the world, or all around like the Middle East. So like if you're in Lebanon, if you're in Jordan, it says location vaccination, local vaccination location. So I'll have a list of all the local vaccinations where you can go. Yes.
Are those locations consistently, do those locations consistently have the vaccines available? Are there any difficulties with shortage that are contributing to this problem in Syria?
I don't know, question. Well, I mean, there's shortages everywhere. There's shortages in the United States, but a lot of it comes from, vaccinations aren't as in a high demand there because people don't go to the doctors like, I want to get this vaccination. So when scientists and medical doctors realize there's more need for it, they're going to supply more. They're not going to supply, like in the United States, they don't make more than, they only make as many vaccinations as they think they'll need. Well, I'm getting $1 billion, so with this whole thing was under $3. So I mean, providing this, there's.
You're asking for money to cover the actual cost of it.
Well, right, I'd have a lot of extra money to be able to do that.
Thank you.
All right, everyone, let's welcome Alessandra to TED.
The secret to change is to focus all of your energy not on fighting the old, but on building the new. Great ideas take time, and how many times have you have a great idea but didn't do anything to implement it? It was just a thought in your head that passed by as you continue your everyday busy life. What if that idea could have made a difference in someone else's life? What if you were one of the reasons that people's lives were saved? All change starts with a simple idea. Before I talk about my idea, I want to show you a few pictures. Look at this little boy's eyes. See the pain and suffering in them. Hear his scream, a cry for help. Observe the gentle sense of touch, holding on to what little hope remains. People in developing countries are affected by certain diseases that cause stigma and discrimination, disability, and a vicious cycle of ill health and poverty. Diseases that can be prevented, managed, and cured cause significant suffering and mortality due to a lack of basic knowledge and inadequate health care. While there are some diseases out there which vaccines are not yet created for, some of the highly prevalent diseases in developing countries can be prevented with immunization. In Liberia, for example, hepatitis A is prevalent, and the best way to prevent it is to be vaccinated. 2 vaccines are available, Havoc being very effective, and 99% of people who are vaccinated, even if they come in contact with it again, they don't receive it. This vaccine, though, requires 2 injections, usually administered 6 months apart. But here lies the problem. The people in Liberia don't have access to these vaccines. My idea would be for have these countries to receive the vaccines to prevent the diseases in that are prevalent in their country specifically. People in developing countries die every single day due to preventable causes, so let's give them one more shot at life. But how? I tried to think on a smaller scale of what impact I could have on these individuals suffering in developing nations. I thought, what better place to start than where I spend 40 hours a week in the summer and the winter at CVS Pharmacy. I'm currently enrolled in the pharmacy program here at URI, and I work at CVS as a pharm tech. The role of pharmacy in society is more than just checking to make sure the correct drug has been filled by the techs, but rather a core function of service. Developing interpersonal relations with the patients and discussing the importance of taking their medications is key. At the store I work at, patient care outreach is stressed. And if it's the first time someone is taking a medication, we as technicians address them to the consultation area to speak with the pharmacist about the important medication and if they have any questions. My wish would to create a partnership among the different CVS pharmacies, for example, and create a friendly competition, because who doesn't like some competition? Each individual store would adopt a country from a pre-selected list with information pertaining to what supplies that country would need specifically. Each store would select a different country. Over the course of 12 months, the pharmacies will try to collect as much money as they can, and the pharmacy that raises the most money, all that money that the CVS collected would go towards purchasing vaccines and other health care supplies that country needs. The option would then be present for 2 or 3 pharmacists to travel to that country to deliver the supplies, administer the vaccines, and stress the importance of healthy habits and drug adherence. Since pharmacy is about patient-centered care with emphasis on understanding the importance of it, why not have a pharmacist be the one to go deliver it? The second component to this program is a partnership with a plane company, private or not, to be the one to send out the pharmacy teams each year. This partnership will reduce the cost of flying and provide a safety net for when the teams have to travel. So how would this money be raised? Working in the store, I have noticed that when small amounts of change are due in return for a transaction, the customer usually says, "Oh, don't worry about the change." Because this messes up our drawer count and it looks like we're doing not accurate transactions, we have to take the change out anyways and leave it on the counter. For what? For it to just sit there? Given the option to customers to donate even such small amounts, such as their spare change, can make a difference. The amount of customers that come into the pharmacy every day is immeasurable. And if one of them each donated 20 cents a day, the amount made within a year would save countable lives. This is relatable because how many of you stop into your local pharmacy when you're sick, or even for a maintenance medication like lisinopril for your blood pressure, or omeprazole for your stomach acid, or even just a day like this when you're having bad allergies? And then think about the amount of times you go to Dunkin', and when you receive your change, you just throw it in a compartment in your car, and the change, you never see it again. What if 200 people took that change and put it towards this cause? So how could we address this concern of the public and get their attention for raising money? In the pharmacy, we wear our white lab coats, and depending on the season, we have like these little tags that usually say, "Get your flu shot now." And because they're red, they stand out, and customers ask, "Oh, where can I get my flu shot?" If these types of tags were made that say, "Help save a life, ask me how," and donate today to give individuals a shot at life, customers would ask what this is all about. Another way to raise awareness would to include a short paragraph or statistics at the bottom of the prescription label. You can see it right there under the information on what the drug is, how it just says CVS Pharmacy, and the acknowledgement. Sometimes it says, "Ask your pharmacist today about this," or "Sign up for our texting app to see when your prescription is ready." What if it said, "Every hour there are 14 deaths in children due to measles. Be the one that helps save their lives." On the CVS website, there can even be a tab for this program, Plans for Change, where you can select a CVS location, see what country they selected to raise money for what diseases are most prevalent, what vaccines we aim to raise money for, how much we hope to reach, and information that this country and plan for change. How could this be placed into effect? It is an idea, and it only remain an idea until action will happen. I could speak to the pharmacists at CVS and get their feedback on how this program would work at our store. I would go to the district manager, regional manager, and climb my way to the top with a proposal. After and if I get my wish approved, I would team up with other members of the pharmacy to research each developing country, what diseases are currently causing the most amount of deaths, if there are any other vaccine programs out there, help already sending vaccines to the countries to create more like a partnership with them to see what other healthcare that we can provide them. With this, a list will be created for each pharmacy to select from. In a meeting held each year, the pharmacy team members will discuss a target goal, just like we have for the amount of flu shots we're supposed to reach each year, and other ways to raise awareness of the problem we can all help fix. One day, I aspire to be a pharmacist, not only by helping better the lives of those who come into the store I'm working at specifically, but to make a change in the life of others. It is with the little steps that we can make a difference in others' lives. We can change this to this. One way for future expansion, if this gets approved, would be to include other pharmacies like community ones or chain ones like Walgreens, Rite Aid, or Walmart. With this greater amount of money, more countries would be reached out to, and in turn, more lives will be saved. If more pharmacies are involved, the frequency of flying to developing countries would be increased as well. Maybe within 6 months versus a year's time, the same goal would be met, and 2 countries would rather be saved that year rather than 1. Vaccinations are a human right and are vital to our global development. The failure to vaccinate people, especially children in developing countries, creates a ripple effect. By vaccinating children across the globe, the rate of child disease and mortality alone would decrease. Children would be more likely to attend school and therefore working, earning money, and getting their family out of poverty. We should all help these individuals get a shot. The reason that birds fly and we can't is simply because they have perfect faith. Faith is to have wings. Let us have that faith and use the wings of the plane to guide us to those countries in need. Together, we can all make a lot of change. Thank you.
So let's say it all works out and you implement your idea. Once you have all of the, like let's say the contest is over and you have a winning pharmacy and they want to go to the country and distribute these drugs, would you work through an organization that's already been established there, or would you set up your own?
Well, I would definitely research the other ones that are already going on there and maybe go to the area that they work at and kind of create a partnership with them, because with the plane already, that's already taken care of. The ride there, everything's all set. It's just kind of where to go from there. So I would definitely be in contact with other ones and see.
Is there a profit motive for CVS to do this?
Just the whole purpose of pharmacy itself is just to help others. And that's my reason to go into it. That's why.
Yeah,
I don't know if everyone else is that way,
I think
but
Tom Ryan would say, you know, it could be a promotion potential for CVS.
I think it
Would
would.
that bring in, would be a draw for more customers by doing this?
I think so, because it shows that they're trying to help others, and if they were in need of help, that we would reach out to them and help them. So I think it definitely would attract more.
Have you spoken to anybody at CVS yet to see if
No, I actually came up with this idea was here. I was looking on the board and I saw the chart for flu shots, and that's where I kind of got it of like, we made a competition of it, because that's when we do the flu shot one, it's a competition as well. So, I mean, I could text my pharmacist today.
That's a nice pull as well, competition, nothing like it.
Oh.
Thank you.
very much. All right, everyone, let's welcome Carr to TED.
Hi everyone, my name is Carl Wilson Jr. and I'm happy to be here today. First of all, before I begin my presentation, I would like to recognize and acknowledge the presence of my brothers, Komla and Mikhail. Komla graduated from URI with 2 degrees in sociology and political science, and Mikhail is from the Côte d'Ivoire where I learned French. All right, so today I'm happy to talk to you, and I'll be talking to you about Liberia. So I felt like it was a little coincidence when the speaker mentioned Liberia. I said, okay, you've mentioned Liberia, what am I going to say next? I got shocked a little bit, but anyway, that's fine.
Is it?
This one? Which one? Okay. All right. My overview. I'm going to talk about the location of Biai Tawe. Biai Tawe is a village where I was born in Liberia. There's a problem that I've identified in Biai Tawe. It's cholera. I'm going to talk about what is cholera. What are some of the causes of cholera? What are some of the preventive measures that we could use to prevent cholera? What are some of the treatments of cholera? And what are the solutions and recommendations of this problem? Okay. BIE, as a country that's a village that's in Liberia, is located in the southeastern part of Grand Jide County. It's little over the size of the University of Rhode Island. It has approximately 500 people. Now, what is cholera? Simply, cholera is a disease that we can get from contaminated water and food, and it is caused by Vibrio cholerae. It says 5 to 10% of healthy people get cholera. So cholera in BI. Cholera erupted in BI because, one, BI, where I'm from, we drink water from creeks and rivers. We have no latrines. There is no health education, or there's a lack of health awareness. So what are some of the preventive measures that we use to solve this problem? Okay, I've said previously that these people go and fetch water from creeks and rivers. So I'm going to talk to them that the water that they get from the creeks and the rivers, make sure that the water is boiled. Make sure their food is cooked well. And they shouldn't defecate in any body of water. Where they have the creeks and rivers, they shouldn't go and defecate there. They should have a designated place where they can go and defecate. They should also have awareness of cholera and infectious diseases. There should be somebody who's going to talk about education, about cholera. What is cholera? Talk to them about cholera. How could you prevent cholera? What causes cholera? So some of the treatments, according to CDC, of cholera are here. There's oral rehydration solution, orange, salt, water is equal to the traditional oral rehydration solution, normal saline, tetracycline, doxycycline, and erythromycin. These are the treatments of cholera. Now, the solutions that I thought about was, this is a problem, and the problem needs to be fixed. How can this problem be fixed? I think there should be like a short-term goal and a long-term goal. And the short-term goal is that people need to be taught how to wash their hands whenever they use the toilets or latrines. Okay? And then people should make sure that their food, whatever food they eat, is washed. Since there's this outbreak, the disease needs to be quarantined or contained, which means that this is a vicinity or a neighborhood that has, or a village that has this problem. The chiefs and elders should make sure that they talk to their people, including local government, to make sure that nobody leaves the village. And also make sure that the neighboring villages, nobody go from their village to the other village, or people from those villages come to the village of the people in BI. So that's one aspect. So my wish actually is for people in BI to be educated about cholera, because education will help them go through this problem. They will know about this outbreak, and they would know about the preventive measures to use for cholera. The long-term goal actually is that local government officials should work with the elders and chiefs and make sure that they construct and build first aid health facilities, so that if somebody gets sick, they will rush them there before taking them to the city where they have the hospitals. And I think I'm all set. Thank you so much.
Thank you.
So you have kind of a cool perspective, actually, having come from this village and seeing firsthand a problem that you can fix. But what can be done from here to address some of the problems of cholera?
From the U.S.? Yeah, the last time I actually reported and spoke about, my friend and I, Lorraine and I, spoke about last mile of health. They actually work few miles away from my village. They work in Zwedru, in Colombo district, and my village is not that far from there. I think one of the things too is that we can talk to them, I will be able to talk to them, that NGO, to say, hey, this is the problem that my people have, and there's an outbreak, can you help? I believe they will be able to do something about it.
Where will the village elders and chiefs, who will they get their information from that they'll be able to bring back and tell their villages about cholera, like causes and how to avoid it?
Okay, I'm educated. All right, I'm educated, and I know I did public health, and I'm well informed. So I will be able to talk to them because I'm from there. So, hey, this is what we can do to prevent cholera. As your son of that village, I think they'll say, oh, this guy's educated. We can listen to him. I'll set them down, discuss with them about this disease and how it could be prevented. And I think they will listen to me too.
So would you then travel between villages to disseminate the information to everybody, seeing as, you do have inter-village interactions, or, you have to come from one village through another to get to the water source and things like that? It's not just one village, but it sounds like a lot of them.
Yeah, because they are neighboring villages, and they should be educated and informed about this, not just my village.
So it'd be you going to those villages?
Yeah, because
You train other people to kind of like.
well, I have the knowledge, and I can train people too, tell them about it, and then I can send them to those villages, because I myself, I can't do everything. I'm just one.